Good evening, everyone. Melanie MacKinnon, the head of Ongomiizwin, Rady Faculty of Health Sciences, University of Manitoba. I am a Cree nurse, originally from Mississippi Cree Nation, and right now I am on Treaty 1 territory and the Métis Nation in St. Laurent, Manitoba. It is an honor to be with you this evening. I wanted to talk a little bit about public policy design and ponder the question on who it serves most. And understanding that public policy is to serve as governments and elected officials. It's there for the protection and the privilege of our providers and our healthcare professionals. It's also there for our policymakers. It's there for our academics and our learners in our institutions. And most importantly, it's there to protect the public safety of the patients and the populations we serve. So it definitely is a must in the area of healthcare and system design. But who does it impact most? And who does it serve most? And so in thinking about that question and learning some lessons from the COVID-19 pandemic and the specific response from Manitoba First Nations Pandemic Response and Coordination Team here in Manitoba, there was many lessons learned. And there was also a lot of heavy lifting. And we wanted to tell you a couple of those stories and those examples in the few minutes that we have together. One of the observations that we had made in our collaborative or our consortium, as we often called it, was that there was several assumptions and biases being made by policymakers and program designers and by either level of government in the case of First Nations specific to Indigenous Services Canada and Manitoba Health in our regional context. And in understanding some of the assumptions and biases, there were, really clear examples around the vaccine clinics and even the urban response, requiring identification to be eligible for a vaccine was a high barrier approach based in bias that most of us have access to personal identification. Or that we can set up a clinic literally, 500 yards from a homeless encampment, and the population and the members of that community would come, which they did not. They did not come because they were really afraid to leave their homes for literally 5 to 10 minutes for fear of the little belongings that they had would be gone by the time they got back. And so that is embedded in, the privilege, the assumptions, and the biases of the few that have a lot of power. So I want us to think about that, and hopefully we can talk about that later in the Q&A as well. I also want to talk about why that matters. Proper public policy design matters because if we don't do it right, we can cause significant harm. And in causing harm, we can have poorer health outcomes and significant impacts to the clients and the populations that we're trying to serve. I talked a little bit about the consortium that we designed in our collaborative approach. Collaboration and the constructing collaborative teams and approaches is absolutely critical. And in doing so, it is multidisciplinary. It has to be multi-agency. It absolutely needs to be multi-departmental, if not interdepartmental. We can't be doing the work that we need to do in the Department of Health alone. We need to be working with our partners in education and housing and all of the other areas that have a social determinant to health impact in regard to that specific policy or program. And we absolutely have to work in a multi-jurisdictional approach. And in doing so, and most importantly, it has to be Indigenous-led and First Nation-led. And that was certainly one of the critical success factors for the Manitoba Pandemic Response and Coordination Team here in Manitoba. So we need to take that multi-disciplinary, agency, departmental, and jurisdictional approach, because what we're all trying to do in our efforts to improve equity and respond to the Truth and Reconciliation Action Plan is to solve or to design solutions to improve the health and the outcomes of Indigenous people, which is a multi-generational complex problem that has been most of our work on the panelists today, as well as most of the work that many of you have been doing as well. And so, as I mentioned, it's a multi-generational complex problem, which can be really overwhelming for our allies and our partners and our leaders. But there are areas where we can start, and we can start with the evidence-based approach, the evidence-based data. And really, really proud that here in Manitoba, we had incredible data and real-time data that enabled us as healthcare leads, Indigenous healthcare leads, to ensure that First Nations in Manitoba were first in line for vaccines, because that's what the ICU data told us that we had to do if we wanted to slow down who we were seeing and who we were treating in our intensive care units. We also have to be cognizant of a low barrier approach and understanding the multiple levels of why. Like, why do we do it this way? Why is it that way? What are we trying to achieve with this potential idea or solution? And just keep chunking down the why to understand what the lowest barrier approach we can take to improving equity, like removing the need for identification to get a vaccine. And the third approach would be along the lines of understanding risk mitigation. Think about, your role within the healthcare system and how we are, responsible to our regulatory bodies. We are responsible to our employers, and those employers and the government agencies have a responsibility to us. But think about some of the policy that's designed in your area of work and try to see what the foundational decisions are around risk mitigation, and then ask yourself the question, who is it trying to protect most? Are we making this decision and acting in this way for whose protection? And we can't hide behind the idea of it's the overall, protection of the public. That's important, that's imperative. But that also can be an excuse for some of our policymakers in the way that they've traditionally done business. And I think, again, all of our regions across this country and across the world learned how to do policy and program delivery differently, with some very, very significant decisions we made within our respective regions. And in closing, I just want us to think about, again, in respect to reconciliation, what, from a policy design perspective, do we really need to reconsider or re-engineer so that we can do things better for the shared populations that we serve across this country, coast to coast to coast? Thank you.